Good afternoon, and thank you for joining us. Today is Tuesday, August 17th, and on today's briefing, we'll hear from Milwaukee County Executive David Crowley, Mayor Tom Barrett, Dr. Ben Weston, Associate Professor with the Medical College of Wisconsin, and Chief Health Policy Advisor with Milwaukee County, and Darren Rausch, Health Officer and Director with the Greenfield Health Department. And before I hand things over today, I want to announce that Dr. Weston is encouraging viewers to submit their COVID questions via Twitter, and he'll answer them on next week's briefing. You can follow him at Ben W. Weston, and please submit your questions this week so he can get ready for next week's briefing. And now I will hand things over to County Executive Crowley to start us off today.
Well, thank you so much, Catherine, and good afternoon to everyone joining us. So yesterday and this morning, we hosted COVID-19 vaccination information sessions to ensure that our employees have the information that they need to make informed decisions about the vaccine. So all of our employees, regardless of their vaccination status, had the opportunity to ask questions and learn more from doctors, public health professionals, and Milwaukee County leaders, including Dr. Weston. And so we were encouraged by the number of employees that attended and actually asked some really important questions that they asked the medical and public health experts. And so our employees are truly on the front lines of service delivery, working while some of our most vulnerable in our community. So it's important that as many people have the facts about the vaccine and actually get vaccinated. And so in keeping up with our efforts to protect our employees, and as we monitor all of the COVID-19 trends in our community, last week, Milwaukee County shared updates regarding our telework policy. And due to the highly contagious Delta variant, we're going to continue our policy that if people can telework, they should do so in efforts to minimize our physical footprint. And we still have many ways for the public to access services online or by phone, but many of our essential services will remain running as well in person. So I want to say thank you, a special thank you to all of our frontline staff workers. And this includes our bus operators, mental health providers, highway and park operators, and all of our other essential workers that are literally keeping many of our critical in-person services running throughout our community. But I'm also pleased to share some updates from our vaccinated employee COVID-19 vaccine recognition program. And so the Vaccinate program offers up to 8 hours of paid time off for fully vaccinated employees. And this is in an effort to vaccinate as many people as possible. And since launching this in July, on July 15th to be exact, the problem that we've seen some positive responses with over 1,800 employees actually showing their proof of vaccination. And so as a result, Vaccinate we will now be available. We're going to continue it to go on until about September 10th. And so this has been a really successful program. And so I want to also encourage other organizations to consider how they could impact similar programs to encourage more people to get vaccinated, but also recognize employees who have chosen to get the shot as well. And so if anybody have any questions about any of the programs or policies that are being discussed today as it relates to Milwaukee County, please don't hesitate to reach out to our office. And you can also visit our website at county.milwaukee.gov. And with that, I'd like to hand it over to Mayor Barrett. Mayor Barrett.
Well, thank you very much, Mr. County Executive, and good afternoon, everyone. Yesterday, the County Executive and I together had the honor of attending McDowell Montessori to welcome back students for the new school year. McDowell Montessori is located approximately 64th and Mount Vernon on Milwaukee's west side. And I've gone to these first day of school celebrations for many, many years. Last year, obviously, we didn't have one, but I would say that this was the most meaningful one I ever attended, because I think we all recognize that COVID-19 has essentially now affected 3 school years. When you think about this, it started in March of 2020. So the tail end of the 2019-2020 school year was affected by COVID. The entire 2020-2021 school year was affected by COVID. And now beginning the 2021-2022 school year, we're all pleased to see our students back in school. I think we recognize now how important it is for the students to be in school. Not only is it the academic progress, but I think the emotional support, the social support, that's important to our children. And I think it's important that we take every measure we can to make sure that they are safe, make sure that their teachers are safe, make sure that staff is safe. So that's why I was very, very pleased while I was there to see students and teachers all wearing masks. I didn't see a single teacher or student going into that school who was not wearing a mask. And I think the reason for this is that the school communities at Milwaukee Public Schools really do appear to be united in protecting the students, the teachers, and other school employees. I'm also pleased that school leaders are saying that everyone who is eligible needs to be vaccinated. That's a very, very important message. And I was pleased that the teachers unions have been supportive of this effort because I think, again, it protects the teachers, it protects the students, it protects everyone. The vaccinations, I think we all recognize, offers protection for the person who gets the vaccine, and it helps protect others, including the young students who are not yet eligible for the COVID-19 vaccine. So let's turn to the metrics, because this is something I think that's of concern to everyone. We remain in the extreme transmission category for COVID-19 cases per 100,000. We're down to 218.2 per 100,000 population. But that still keeps us in the extreme transmission, even though we're down a little bit. Our percent positivity rate has dropped to the substantial transmission category, and we're there now. We're at 9.5%. So it's good to see that drop, but it's still substantial transmission. Our vaccination rate, 51.8% of city of Milwaukee adults, individuals 16 or older, are fully vaccinated, and 56.9% of adults have received at least one dose. So we're slowly making progress here, but we know we have a long way to go. So let's hope that we've gotten past the worst of the Delta COVID surge. I'm not convinced we have, but the only way to be sure is to continue to take all the steps: vaccination, avoiding crowds, and masks that we need to do. I want to talk a little bit about additional vaccination doses, because this has been in the news a lot over the last 48 hours. The Milwaukee Health Department is working closely with the Wisconsin Department of Health Services and is following its guidance regarding additional doses of the COVID-19 or mRNA vaccines for immunocompromised people who may not be fully protected from the first two doses. The health department will be offering a third dose to eligible individuals who received 2 prior doses of mRNA. That's the Pfizer or the Moderna COVID-19 vaccine. At this time, there are not additional doses recommended for immunocompromised people who received the Johnson & Johnson vaccine, nor are booster doses for the general population recommended. Although, again, we're hearing more coming out of Washington and the Biden administration about a recommendation for that booster shot. The health department continues to offer only Pfizer and Johnson & Johnson, though other local vaccinators are also offering Moderna. Summerfest is still obviously on the books, with Summerfest and other venues starting to implement COVID-19 vaccine requirements. Proof of vaccination is important. If you have lost your COVID-19 vaccination card, you can access your immunization record online in the Wisconsin Immunization Registry. Go to dhfswir.org and select Public Immunization Record Access so that you can prove that you have been vaccinated. Again, I think that this is going to be more relevant in the coming weeks. This week, the Milwaukee Health Department will be administering vaccinations at the following church, school, and community organizations. Tomorrow, Wednesday, August 18th, they'll be over at Pius XI High School from 9 a.m. to 2:30 p.m. They'll also be at North Division High School from 11 a.m. to noon. They'll be at Ascension All Saints Family Health Center from 1 to 4 p.m. and at the St. Hyacinth Food Pantry from 3:45 to 6 p.m. Saturday, they'll be at Northwest Catholic School from 10 a.m. to noon. Monday, they'll be at Bria of Trinity from 9 a.m. to 11 a.m. They'll be at Canaan Baptist Church from 10 a.m. to 1 p.m. And they'll be back at Pius again next Monday, August 23rd, from 2 to 7:30 p.m. Tuesday, they'll be over at UWM at the UWM Student Union from 11 a.m. to 3 p.m. Shifting gears here a little bit, last week, the Milwaukee Health Department partnered up with the Milwaukee Black Child Development Initiative on the Sleeves Up for the Kids webinar, where participants could learn about the effectiveness of the COVID-19 vaccine through a panel of local, medical, and community leaders. If you missed the webinar but would like to learn more, access a live broadcast on the Milwaukee Health Department Facebook page. Finally, I want to continue to highlight our community mobilizers who are doing the important work of having important dialogues about the COVID-19 vaccine with Milwaukee residents. They're out in the neighborhoods, they're knocking on doors, they're answering questions, and they're connecting people directly with the vaccine. There have now been close to 500 vaccinations administered since the start of this program. So they're out there, they're knocking on doors, and they're trying to meet people where they are. And I want to thank each and every one of them. So with that, I'm going to turn it over to Dr. Weston, the newly promoted Dr. Weston.
Thank you, Mr. Mayor. Good afternoon. First, briefly, I've seen from conversations with patients on an individual level and on a broader level in town halls, there are so many great and important questions out there. So many people who just want a bit more information about the vaccine. So as Catherine mentioned at the top of the briefing, if you're on Twitter, please submit your questions to @BenWWeston. We started a conversation there. I'll do my best to answer many questions right there, but I'll also bring some for the upcoming briefings. And be forewarned, I'm new to Twitter. I've only been on a couple weeks, so bear with me. I'm still trying to figure it all out. All right, now on to our numbers. We're seeing in Milwaukee County an average of 256 new cases per day and about 2 deaths per day. And we are starting to see a bit of a plateauing or even a slight downtrend in our cases. Now, it's too early to say if this will be sustained. Hopefully it will, but we're cautious. Cautious as we see the rest of the country continue with an increase in cases, as we see children return to school, and certainly as we enter cooler weather coming up in the next few months, soon with more indoor gathering. Now, at the same time, our hospitalizations do continue to rise. We now have 190 patients hospitalized in the county with COVID. That's 10 times what we saw just about a month ago. Now, we've had quite a bit of news over the last week regarding additional doses and booster doses of the COVID vaccine. So first, I wanted to clarify a bit of detail on the difference between those two. So what we heard last week was that the FDA authorized an additional dose of the vaccine for people with immune compromise. Now, that's about 3% of the population, and it includes people with certain cancers, with organ or stem cell transplants, with diseases that cause immunodeficiency, people living with HIV, and those on certain medications. Now, not only are these individuals more likely to get very sick from COVID, but studies both here in the United States as well as in Israel show that the immunocompromised people who are vaccinated are more likely to have breakthrough infections than their non-immunocompromised counterparts. Now, specifically with the Delta variant. And more focused studies show that in this immunocompromised population, those who did not get a robust immune response from the second dose of their mRNA vaccine had an improved response after they got that additional or third dose. So based on this newly accumulated evidence, the FDA authorized this additional dose for those who are immune compromised. And we're beginning to see that operationalized now in our health systems and our health departments. Now, this is different from the booster dose that we heard about last night. So while that additional dose is to further improve the immune response in those who didn't initially have a robust immune response, the booster dose that we heard about last night is for those whose immune response to the virus has weakened over time. Now, one key study that's influenced this decision is also out of Israel, which had a really robust early vaccination program, more so than many other countries. And there in Israel, we're seeing that particularly in older individuals who were vaccinated way back in January, they're having more breakthrough infections than those who were vaccinated more recently. And while still most of these cases are mild, since they're among vaccinated people, it still suggests some waning of the immune response over time. Now, this is also likely coupled with increased transmissibility and severity of the currently circulating Delta strain. The information on booster doses is still coming out, and we'll continue to follow the evidence and the guidance from the FDA and the CDC. So since this is all fairly complex, a quick summary: additional dose of the vaccine is authorized for immunocompromised who may not have as robust an initial response from the vaccine series. On the other hand, the booster dose that's now being discussed would be for anyone who received their vaccine dose 8 months ago when it first became available. Now, in the meantime, for those who've not yet gotten vaccinated, now is the time. The Delta variant is widely spread, and the vaccine significantly decreases your risk of infection, your risk of severe symptoms, your risk of hospitalization, and your risk of death. So visit healthymke.com to find a fast easy, and free vaccine near you. Thank you and stay safe, and I'll hand it to Health Officer Roush.
Good afternoon, and thank you, Dr. Weston. It's my pleasure to join today to talk a little bit more about COVID-19. So in my comments today, I'm not going to share the usual data report, but I do want to hit some highlights on the data for this week, really in light of a lot of the things changing over the last few weeks. And I'll certainly add on to where both Mayor Barrett, County Executive Crowley, and Dr. Weston had made some comments earlier about COVID transmission and vaccination and more. So one of the things I want to start with, just as far as the data goes, is talk about COVID transmission in our community. Right now, COVID-19 is very active in our community, and Dr. Weston mentioned moments ago that we're seeing a bit of a plateau, but it's too early to know if that's a trend or if that's just current status and things will continue to go in an upward trajectory. Just don't know. But at this point, as we've heard, cases, hospitalizations, and deaths have been increasing in recent weeks. And certainly we have told you before, and we continue to see that the majority of those cases are occurring in individuals who are unvaccinated. And another important note, and this is a real key part of the narrative that we're seeing nationwide as well, is that the proportion of cases in children has been increasing over the past several weeks compared to earlier weeks in the pandemic. So over the past 3 weeks here in Milwaukee County, the proportion of kids as a proportion of total COVID cases has been slightly higher than 20%. This is consistent with nationwide data, and some of the nationwide data that I've seen has reported that kids have represented as many as 18% of current cases nationwide within the past week. Now, why is it important and why do I continue to talk about kids? Well, like many residents in Milwaukee County, many of us have children under the age of 11 who are currently not eligible to receive COVID vaccine. And so the narrative about disease occurring in kids will continue to grow and will continue on in the coming weeks and months because there's a large proportion of kids who are not eligible for vaccination. And as we know, we need to vaccinate ourselves out of this problem. COVID will not simply go away, as you've heard other speakers talk about. So in addition to talking about the Milwaukee County data, I just want to flag another key data point for you. And it's very important, and I don't think it's gotten enough traction yet. But in looking at both the nationwide data as well as data here in the state of Wisconsin, the current peak that we're in has contributed more cases than the early peaks early in the pandemic back in March and June and July of 2020. So again, there are more cases now, both statewide and nationwide, than we saw in the early months of the pandemic. And that's very notable because we have vaccine now, and we didn't have that 18 months ago. So that's certainly a trend that we're watching. Here in Milwaukee County, that hasn't been the case. The early months of the pandemic were still a little bit higher than where we're sitting currently. But it's certainly important to note that even despite vaccination, those rates nationwide and statewide are very high. So as I've said, the news in Milwaukee County is a little bit different, but pretty similar to other parts of the country. We know that the Delta variant is fueling a lot of the significant increase in COVID cases over the past several weeks, and particularly in the southern US. But we know Delta has really gained a foothold over the last several weeks here in Wisconsin as well. Looking at the state of Wisconsin laboratory data, we continue to see that Delta is the vast majority of current cases. And with Delta comes a greater need to revisit and reconsider all of those COVID mitigation measures that we've been doing before. And we know, as I've said in the past, breakthrough cases have been part of the equation here recently. With waning immunity, especially amongst immunocompromised individuals, we are seeing some breakthrough cases, but by and large, those breakthrough cases are still pretty small. And while they are a growing proportion, the majority of cases are occurring in those who are unvaccinated. So where does that leave us in light of the fact that some schools have started already this week and other schools will be coming forward? That's a good question. It's been one that colleagues and I have been asked time and time again over the last several weeks. Remember that we know what works to keep us safe. We've been talking about this for many months. I have been on these briefings talking about the Swiss cheese approach to COVID safety. We know things like vaccination, first and foremost, is very important. We know that masks and physical distancing, hand hygiene, and cough etiquette are also very important. And we know that measures like being outside, having good ventilation, and other public health measures, including isolation and quarantine, have been very effective. And by and large, these are the strategies that nationwide groups like the American Academy of Pediatrics, the Centers for Disease Control are recommending schools consider. Locally, the Wisconsin Department of Health Services has made similar recommendations for schools to follow all of those layered approaches to keep kids safe. And then lastly, here in Milwaukee County, all 11 local health department health officials have supported and continued to recommend the layered approaches to mitigation strategies everywhere, but certainly especially in schools, as well as our statewide Wisconsin Association of Local Health Departments and Boards making similar recommendations. So we know the solution. We just need to work to implement those solutions in our communities and in our workplaces and in our schools. So as has been mentioned in the past, the path out of the pandemic continues to include vaccination as a key strategy. Dr. Weston mentioned this previously as well. There is a lot of news about boosters coming out, and those details are getting firmed up, but certainly we know immunocompromised are high on that list for boosters, and there may be others that we talk about needing boosters in the coming days and weeks. All of the vaccines continue to be safe and effective, and they continue to be plentiful. And by going to healthymke.com, you can find resources on where to find vaccine in your community. And we certainly hope that you will do your part to increase vaccination rates and keep you, your family, and your community safe. So with that, I'll turn the briefing over to Catherine for the Q&A portion.
Thank you, Director Roush. Our first question is for Mayor Barrett, and it comes from Derek Rose with WISN 12. He says, Mayor, you mentioned that the Milwaukee Health Department will offer the third dose for immunocompromised patients. When is the date for that to begin?
Well, thanks, Catherine, for that question. Well, this tells you how quickly this entire situation continues to evolve. We actually got an update from the State Department of Health Services last night when it sent us information regarding the additional dose. That came at 6:30 last night. Right after that, Dr. Parity and others at the health department began working on really updating the medical order. And as of now, that order has been updated. So individuals, again, who are immunocompromised, not everyone, this is not the booster. These are for the individuals who are immunocompromised. And Dr. Weston talked about the small percentage of people who would fit that category. They are eligible as of today to receive that shot from the City of Milwaukee Health Department.
All right, thank you for the real-time updates. Our next question comes from Team J4. And Director Roush, I know you covered off on this, but I will ask it again in case there's any additional feedback to add here. Is there a concern that a surge is coming as students return to school? And with rising hospitalizations, how is the county preparing for a potential surge from the Delta variant?
We've talked certainly before, we've certainly talked over the last several weeks and several months that any opportunity where people are congregating and gathering, we have the opportunity for increased COVID transmission. And certainly myself and other public health colleagues would feel the same about school starting. There's lots of benefits, as the mayor and others have talked about getting students back in the classroom and keeping them there safely. But at the same time, we certainly do have concerns about COVID transmission rates, increasing in the school setting, on the football fields, at other school events. It's a likelihood, and there's a good probability that it will happen. It's hard to predict, but certainly when more people are mixing in smaller enclosed spaces like a school setting, it's certainly possible. How the county is preparing, the 11 health departments in the county have continued to meet regularly. We started that 18 months ago, and we certainly aren't stopping. We're continuing to engage public health partners, the local hospital systems, and others to continue to engage in dialogue to push out the media messages, push out the important mitigation strategies to schools and school leaders, and continue to do vigorous contact tracing and case investigations throughout Milwaukee County.
Thank you, Director Rausch. Our next few questions come from Allison Durr with the Milwaukee Journal Sentinel. I'll ask them one at a time as they're for different experts. The first one is for Mayor Barrett. She says, Dane County implemented an indoor mask mandate starting Thursday. Will Milwaukee follow Dane County's lead and implement a mask mandate soon?
Well, as you may recall, when we had our mask mandate, we did it by working through the Common Council. And we did that because we felt that working through the Common Council and having that pass as, in essence, an ordinance would help us withstand legal attacks. I think we all recognize that this is has become a very political issue. We know the Supreme Court has not viewed health department orders particularly sympathetically. And so our plan is to continue to work with the council. We are monitoring these numbers very, very closely. I know that Alderwoman Dimitrievich is very interested in having a mask mandate back. We've been talking to her, but we're going to be looking at the numbers and we're going to see whether when the council returns in the beginning of September, whether that's the appropriate step. I will say that we continue to focus at the health department on vaccinations. We continue to believe that that is by far the most effective tool, notwithstanding all of the breakthrough cases, notwithstanding the fact that we now know that as time goes past, the efficacy of them might diminish somewhat. We still think vaccinations are really the path out of this. But we are, again, looking at the data. We'll be working with the council to see whether that's the step we should take when the council returns in several weeks.
Allison's second question is for health experts on the call. Do you have an updated time frame for when the breakthrough case data from Milwaukee County will be available?
That's a good question, certainly something I'm interested in too, Allison. The answer really remains the same as last week. Last week, we had some of our data team folks on vacation. I just emailed earlier this week asking about an update on that particular variable or set of variables. And so certainly I hope it's available this week or next week, but I'll know more tomorrow when the EPI team meets.
And the next question for Director Rausch. On the weekly kids report regarding hospitalizations, there's a note that says total children hospitalized for COVID-19 with specimen collection date within the last 30 days. Are you able to clarify what this means? And if one child is in the hospital a week ago, and they're still there a week later, the same child could be counted in multiple reports, correct?
I'm going to start by saying incorrect, and then I'll explain what that means. So our case reports talk about cases of illness. So they're always person-based. So in the case of the kids report, it's kids under the age of 18 who have had COVID. We added this disclaimer a few weeks ago. It's been on there for the last 3 or 4 weeks, just saying that we're only counting hospitalizations within the last 30 days. So first, to be included in the report, you have to have COVID. And to be included in the hospitalization count, you have to have been hospitalized as indicated in the case investigation and contact tracing protocol. So there's no double counting. There's no double counting of hospitalizations. It's a patient-based record, and we're counting cases and whether or not they're hospitalized.
And on that note, Allison is wondering, how concerning are the 17 hospitalizations of children as of last week's report? And it's an increase from previous weeks, but still seems like a relatively small figure.
Sure. Yeah, so I'll couch my conversation about the numbers as I have in the past. It's easy to dismiss these as just numbers. It's a dozen kids, it's 17 kids. But remember, these are people, and when we talk about kids, these are little people. These are somebody's, children, son, daughter, etc. Increases are concerning, but I can't tell you as an epidemiologist and a public health professional at what point we should really begin to shine a light on this and be more focused on it. 17 is a lot, but the county of Milwaukee is nearly 1 million people. So while it might not seem like a lot, the trend is increasing. And where I would continue to focus our attention is that the trends in cases, the trends in hospitalizations, and the trends in deaths continue to increase across the population. We're seeing the proportion of kids as a total of all cases increasing, and we're certainly seeing evidence that there are more hospitalizations in kids even. So they are numbers, they are small, but it's the trend that we need to be watching, and we should be concerned about it when it's small versus when it's up over 100, because at that point it'll be too late.
Our next few questions come from Mary Jo Ola with TMJ4. The first one is for Mayor Barrett. She asks, how is the health department following up to get immunocompromised people their third dose? And how many third doses has the health department administered in this population?
Well, again, we basically have just begun doing this today, so I'm assuming not very many. But as we get that information and as we get more data on this, we'll be happy to release it. But again, as I said, all of this is basically about 18 hours old, so we haven't done a lot of compilation of statistics yet. In terms of the outreach, that's something we'll be discussing with the health department to see how to do it. I'm assuming that a lot of this will be done through individuals' consultation with their personal physicians or other healthcare experts to see who should be the ones receiving the shot for this, again, vulnerable population.
Mary Jo's second question is for Dr. Weston. She says, do you think booster shots will reverse current COVID trends if these are people who already got vaccinated while there remains populations of people who have not gotten their initial shots?
The short answer is no. I don't think booster shots are the key to reversing our current trends. As we see when we look nationally, when we look to other states, and even parts of Wisconsin, the vast majority of infections, of people with severe symptoms, of hospitalizations and deaths, are all people who have not yet received any doses of vaccine and certainly are not fully vaccinated. And so while the booster doses will help to maintain that immunity in people who were previously vaccinated, I don't think it's the key to reversing our current trends.
I'm seeing one more question from Brett Lemoyne with Fox 6. He asks, what should be done if you are immunocompromised and previously got the Johnson & Johnson vaccine?
So if you're immunocompromised and previously got the Johnson & Johnson vaccine, there's a lot of different people who are immunocompromised for a lot of different reasons. I would suggest talking with your healthcare provider and going from there for the next best steps.
Right. Those appear to be all of the questions I'm seeing in the chat right now. Just a reminder for those who are tuning in, please feel free to submit your questions about COVID to Dr. Ben Weston at Ben W. Weston on Twitter. We'll be answering those questions live on Twitter and on next week's briefing. So thank you for tuning in. Hopefully you'll tune in again next week. And that concludes our briefing for today. Thank you all.
Thanks,
Thanks, everybody.
Thank you.
Bye.